Okay, today's class will be a Vinyasa flow class. It'll be strong in parts, but also there'll be some time to move and really feel how it feels in your body. The main aim of today's class will be to show you how we can put the theoretical that we learn about the agonist and antagonist muscles into the practical. So how can we use our knowledge of muscle activation and the way that a muscle stretches and the way that a muscle contracts, and how can we put it into practical to make our class a really strong but safe class, but super beneficial. So today's class, we're going to use two main muscles to do that, which will be our iliopsoas muscle and our gluteus maximus. So a little bit of anatomy first, just to remind you. So the gluteus maximus starts from that PSIS that it comes across the sacrum and the ilium. It creates the gluteal fold and attaches laterally onto the gluteal tuberosity. The action of the glute max will be to extend the hip, so we'll be doing a lot of this today to switch this on, and it also does external rotation. So again, we'll be doing lots of extension and external rotation to switch this on. What happens when we switch the glute on is that we have to switch off through our iliopsoas muscle to allow for that action of hip extension. So iliopsoas, two main muscles which come together to come and create the iliopsoas. Iliacus, which lies inside the hip crest, and then the psoas, which starts at the transverse process of T12. It articulates along the transverse processes of the lumbar spine and then crosses and attaches onto the lesser trochanter of the femur. Remember, the psoas muscle and the iliacus together do hip flexion. They hold us in an upright position when we're seated, and they help create that natural lumbar lordosis. Okay? The common thing that you will see in someone, they get up in the morning, they drive to work, so they're sitting, which means that the psoas is on, so really tight, and the glutes are weak. They sit all day at work, and then they get in the car again, they sit to drive to yoga, so maybe they've been seated for maybe 8-9 hours that day. And then they come to their yoga class and the teacher says, today we're going to do a backbending sequencing class. Now, with backbending, we want there to be hip extension. So glute activation has to be on and the psoas has to be open to allow for that. What we're going to commonly see is that perhaps the teacher, or even just the way that the class is sequenced, doesn't open up through the front of the hip enough to allow for that elongation through the iliopsoas to allow for the glute max to switch on. The other common thing that you'll see is that the glute max doesn't switch on enough, or the student doesn't know how to because they've been sitting all day, so it's weak. So when they come into something like our stronger back bends, even something like, say, camel pose, the student, when they come into that fold back, rather than using the glute max to switch on to create the hip extension, they will use perhaps their hamstrings or their lower erector spinae to switch on and create the bend. Now, we do need to use the hamstrings and lower erector spinae a little bit in the extension to create it, but we don't want it to first and foremost or get all the strength from there. We do want to have some strength from glute max. So my aim for the class today is to switch on through the glutes early and often and open up through the front of the hips early and often. And we're going to keep reminding you this like a broken record throughout the class to hopefully create a really safe environment so that the student then doesn't end up with lumbar pain, sacral pain, hip issues or knee issues because they haven't switched on through the glutes and they haven't opened up through their psoas, and then they're asked to come into a back bend. So today's class will be a lot about cueing. The sequencing is all planned out so that we make sure we can do those things and make it a really strong, safe class for you. Okay, so before we start the class, if you want to grab any props to help you with the class, you might want to grab a block or a cushion or a bolster or a strap. And then you can come onto your mat and start where Jyoti is in our little mini Shavasana. In this time, I want you to leave all your thoughts behind about, anything that's coming up, anything that's in the past, and can you just see if we can start to bring your attention towards your breath. My main aim about bringing your attention towards your breath at this point of the class, obviously it's yoga, so yes, we always do, but there is intention towards it for right now. So if we start to use the belly to breathe, due to the close relationship with the diaphragm and the psoas, meaning that they are literally attached right next to each other on that upper lumbar vertebrae. We are going to start to bring some awareness and some articulation just by starting to breathe a little deeper into the belly to the psoas. And that's going to help us when we require some more stretch and more articulation through the psoas a little bit later. So if you feel like you've already started to, yep, I've connected with my breath and I can feel a little bit of rise and a fall in my belly, my rib cage is moving laterally, there's a little bit of an ascend through the front of my chest. And as I breathe in, I can feel the posterior back of my, or posterior rib cage, inhale and really open. Then you can start to continue with this, but we're going to move into Supta Baddha Konasana. So soles of the feet together, knees out wide. You may find that this position actually starts to help you with the breath because we start to open up a little bit through the pelvic floor, just from bringing the legs into that external rotation position. We're stretching through the inner thighs. You're allowing the knees to soften. We're starting to allow the breath to really descend all the way down. And then as you breathe in, there's this light contraction of the pelvic floor. And there's this natural recoil of the rib cage and of the diaphragm all the way back to center. I'm going to leave you for a few rounds of breaths. Notice if in those moments of quiet, if your mind started to distract you. No judgment, but can you stay with what's in front of you, what's happening right now to the body and to the breath. You may like to use your hands to guide the legs back long, or simply lengthen one leg and then the other. And then keep the left leg long and start to hug the right knee in towards the chest. Now I'm going to get you to start to do some little knee circles. And what I want you to think about is how the femur bone, that thigh bone, is situated and articulating into the hip socket. So when you bring the knee to the chest, there's this little bit of flexion, then there's this external rotation, abduction as you bring it out to the side. A little bit of extension, then you're coming back to internal rotation, adduction, then back to flexion. And then next time you're in flexion, I want you to hold that, hugging it in, and then can you see if you can float this left leg off the ground, allowing the toes to come towards you, and we're starting to warm up and strengthen through the front of this left leg. Hold it a little higher, and then let the left leg go. Find a spinal twist as you bring the right leg across. You're welcome to bring your arms out long or out wide to help open up through your pecs, your biceps. Continue with that awareness of the breath. So remember, we said that the diaphragm and the psoas articulates from that transverse process of the T12 and those upper lumbar vertebrae. So by starting to create this twist through the lumbar vertebrae and that lower thoracic cage, we're starting to articulate through the psoas as well as the diaphragm attachments. Next breath in, start to unravel and unwind. And we're going to swap sides. Right leg will come long, left leg hugs in. So the right leg's nice and long to begin with, and we're doing those knee circles or those leg circles through the left. Now, although it's the knee that's moving, I want you to think about how is the femur bone articulating into the hip socket. If there's any sharpness or pain, I want you to reduce that length. So see if you can go a little less, not too much extreme. Perhaps it's happening in flexion and maybe it's happening in internal rotation or when you bring the leg more across the body. So I want you to avoid any points of that. And then the next time the hip comes into flexion towards you, can you lift the right leg, draw the toes towards you, and activate through the front of the hip here, the front of the rectus femoris. We're starting to warm up through the anterior portion of the right leg. Then let the leg go, find a twist. If it feels a little strong through your sacrum or through your lower spine here, remember we can come into that alternate twist where we bring the hands together and then we allow that opening, that rainbow opening through the arms as we move more through that torso, the thoracic cage, rather than just allowing the twist to happen more at the lumbar vertebrae and that pelvic girdle. Take one more round of breath. Then let's prepare for a bridge position. As you come back, bring the hands near you. What I want you to think about doing, you may actually feel like you want to bring it with you, and it's to pop a block in between your thighs to help activate through your adductors. Or you can just think about it as switching on through there. What I want you to do is press the heels down. The next time you take a breath in, can you engage slightly through the glutes as you lift the hips up? Now remember about the adduction, so we're thinking about hugging the legs in. That's going to help keep some strength and stability here, especially through that sacrum. Can you see if you can lift a little higher through the hips whilst pressing down at the same time through the heels? So that press down through the heels is going to help to switch on through the hamstrings and the glutes. Can you lower down halfway? And then can you lift back up? Now I'm going to really test Jyoti here because I want to, but you can feel like, if you feel like this is enough for you, you can stay here. Otherwise, all I want to do is I want to see what happens with Jyoti when I ask her to transfer her weight to one leg. So I want her to keep her left leg here, and what I want to do is come up onto the tippy toes of the right leg, and then can you lift this leg off the ground without losing the height of the legs? What I'm trying to do is test her glute stability on this standing side. She's okay. Let's see the other side. So press the right foot down when you're ready. You can have a moment of pause in between. And then we want to see that there's not a translation. So there was a little dip there, a little translation, especially through this left hip. So if we come back down, we're going to do that again. I'm going to get Jyoti to put her hands on the front of her hips. Okay, from here, we're going to make sure we really press into here. This glute is stabilizing you. So we're not going to move. We don't want to feel any tilt or tip through the hips. And from there, can you come up onto the heel like she's already done? And then can you float this leg? That's much better. Great. Okay, so sometimes we just need that little bit of extra awareness with the hands. Then you can come down, lower all the way down, hug the knees into chest, a little break, a little pause. Maybe some circles one way, maybe circles the other way, maybe just a rock. And we're really going to start to test psoas here. So you're going to start to rock and roll up and down the spine, and you're going to end up in a boat pose. So you can do it once, you can do it twice, you can just come up to boat if you don't like the rocking. Now, okay, great. So she's here. From here, I want to see if we can lift a little more through the crown of the head. Great. So that's going to help this. But what I want to do is, can we activate through psoas? So remember, psoas attachment, transverse process T12, lesser trochanter of the femur. So I'm going to tell Jyoti, can you bring your inner thigh a little bit closer towards your belly button? That's going to help her switch on rather than just press her hips forward. It's going to create that muscular activation. You can definitely come out of that now. You can rock over. Let's come to all fours. Let's feel what it feels like to feel some weight through the hands. So you can rock forward and back. Whatever you feel like you want to do here. It's your own little time for articulation, for range of movement. If we've lost the breath, let's bring it back. Let's see if we can continue and carry it throughout the class. Good. Now I'm going to see what it feels like in a all fours position. So if Jyoti's really tight through her psoas, and or I should say, if she has an anatomical variation, meaning that she's got an anterior tilt, meaning that I'm going to bring her hips more into this anterior tilt. So this may be Jyoti. She may have an excessive lumbar lordosis here, and that's okay. This may be how she's made up. She may have a anterior tilt through the pelvis, creating this lordosis, or she may be really tight through her psoas. So if she's tight through her psoas, and I know if this was Jyoti, I know she doesn't usually look like this, so I know it would be her psoas that's pulling her into that anterior tilt. I'm going to get her to draw her belly button, or draw, yeah, she's already changed it for me. So her belly button's come up towards her spine, and what she's also done is allowed her lower ribs to come towards her front of her hips. So we're in a neutral spine. She's pressing the ground away because we haven't forgot about the protraction. From here, can you float the right leg behind you into hip extension? Great. So we're just here. We're not going to lift too high or too wide. We're going to allow the toes to face you. Good. So this is switching on through the hamstring, the glute max on this side. Then you're going to bend this knee. Cool. From here, we're going to allow a little bit of external rotation because remember, glute max does external and hip extension. Great. From here, there's going to be some little pulses. So we want to move. We can see her glutes activating, but I want to really move. We're going to slow it down, and we're going to more move just through there, the ankle. So I don't want to see too much thrust or movement happening through the hips. We want to see it more through the foot and the lift up through the foot, but the engagement through the glutes. And what I want to see is that she hasn't started to create that anterior tilt. Now, if that is Jyoti's anatomical variation, then so be it. But I know it wasn't, so I know she has to keep that core on, keep the protraction, press away. You can step the right foot forward, find a little low lunge. Rock forward and back. So this is your time. Feel what the hamstrings are feeling like. Remember I said before that if the hamstrings are switching on, that means that when we do hip extension, the hamstrings are going to override that and the glute's going to be weak and it's not going to be as good for your back, for your sacrum. So we want to make sure that hamstrings are long as well. Okay, now from here, if lizard feels a little too strong for you, take low lunge instead. But from here, we can all do it from lizard or low lunge. Is the left heel is going to come towards the buttocks. So what am I doing here? So little pulses as the leg lengthens. So I'm trying to get Jyoti's hamstring and glute max on this left side to switch on. So I'm teasing the muscle to just like activate, activate, switch on, which is going to help through reciprocal inhibition and that agonist and antagonistic relationship. It's going to help switch off through that front of the hip. So then the next time she lifts it down, leave it down, and you're going to see if you can come a little bit further into that lizard or the low lunge. Okay. A breath, a little reprieve here. Remember, we want to switch off through the front of the hips because let's say Jyoti's a desk worker and she's been sitting all day. We want to make sure that we're opening there. So when we come into something a little stronger a little later in the class, she's able to do so. Bring the hands back to the earth, press into the hands, step the left foot forward, find Malasana or squat pose. Now I know Jyoti's going to be able to come all the way down. For some of you, you may want to sit up a little bit more and you may even want to put a block underneath you if you feel like this is too strong at this point of the class. So pelvic floor is descending, relaxing. We're getting some opening through the inner thighs. But let's not get lazy through our legs here. So what I want you to do is think, yeah, she's already changed it. So think about pressing the heels down. That's going to help you because in the next breath, I want you to press the heels so much down that you rise up to chair. We're not coming all the way up, unfortunately. We're going to stay in that little bit of a burner through the legs. Now, like we did in bridge pose, I want you to think about there's a block in between here. Again, we've got that play of that anterior tilt. Now, if Jyoti had an anatomical variation where she had an anterior tilt, I would leave her, but I know she doesn't, so I know she can switch on through her core more. So how do I do that? So we're going to go back into the anterior tilt. She's going to switch on her core more by softening her lower ribs towards the front of the hips and her belly button back, so that's strengthening through that core. Like we did in bridge, she's going to keep the left leg as it is, and then we're going to transfer the weight to the left foot. The right foot is going to step up and back just a little tap and then come back. A little tap and come back. So we're teasing this stability of this left gluteus medius by standing on one leg. Can you do one more, back, exhale, fold all the way down. A little reprieve, a little moment in time where we can stretch through the hamstrings, which is going to help us to not override with the hamstrings through that hip extension. Take an inhale, lift halfway. Now, what I want you to do here is bring your hands onto your shins and actually lift up halfway. Good. Can you see if you can allow your chin to soften down? So we've got length through the neck, length through the back. And what I want you to feel here is in that hamstrings. So really press the heels down. Great. And think about lifting the sit bones. Good. Exhale, fold down. Let's do 2 more rounds. Again, we're going to work on this repetition to switch on those posterior muscles rather than just folding forward, folding forward, folding forward. Inhale, reach the arms all the way up. Lengthen the breath. Exhale, we fold all the way down. Step back. Press the hands down to find protraction. Step the legs back. You can do one at a time. You can do both. It doesn't matter. And then I want you to shift your weight forward onto your toes. Lower the knees for this first round. Eccentric contraction through the triceps as the elbows bend back. Lower all the way down. So you're going to keep the arms by the side. The torso, the arms are going to do absolutely nothing in these first few rounds. And we're going to work on the legs. So can you relax through the arms? And can you think about just lifting, or can you actually just lift the legs up? So, and down. So what I'm watching here is I'm seeing if Jyoti's glutes can switch on, then the hamstrings and the lower rectus spinae. So I want to see some glute activation. And I want to see more relaxation through this torso and more activation through the glutes. Let's just do one more. This time you're going to bend, stay up, stay up, stay up. This time you're going to bend the knees. Cool. Again, there's that imaginary block in between the thighs. Switch on, lift the legs a little higher. Downward facing dog. Yeah, a little audible breath. A sigh, a pedal. Remember, we are working through the legs here, so you might feel like you really want to rinse out the legs. Pedal, pedal, pedal. You might feel like you want to shake the hips one way and then the other. All right, then you're going to lower down to all fours. Again, we're going to look for that anterior tilt. We're going to make sure there's that protraction in the scapula. There's that core switching on by the belly lifting up, the belly button lifting up towards the base of the spine. There's that softening of the lower ribs towards the front of the hips. From there, there's no tilt. So it's like if I could put a block on her back, there's going to be no tilt with her hips. So there's stationary here, and then the left leg is going to lift up to that extension. So I think without externally rotating, Jyoti could lift a little bit higher. Then we want to bend the knee. And now we open up the hip a little with this external rotation. We're going to lift from there. So the heel is lifting up. There's control, and we want to feel this in the glutes. We want to feel even weight through the hands. So what you'll most commonly feel is that you've now shifted the weight to the right hand. Can you bring it back to the left as well? And can you keep pressing the ground away? Good. 1, 2, 3, lizard lunge or low lunge. Step the left foot forward. Rock forward and back. So this is your little play time, your little time of reprieve to see what's changed, what hasn't changed. There's never any judgment on your own practice or where you're at today or how it feels today. It's just an awareness. Okay, next time you come into lizard lunge or low lunge, let's find those pulses of the back leg as the right heel comes close towards the bottom. So again, we're switching on through glute max on this side, the hamstring on this side, which is going to help switch off through that psoas when we come into the either lizard lunge or the low lunge. Let's do one more. And soften. Find your variation. You might want to stay on your hands. You might want to come onto your forearms. Take one more round of breath. And then you're going to prepare by bringing your hands down. The right foot steps forward into Malasana this time. There's strength in the legs even though they're apart. You press down through the heels. A relaxation through the pelvic floor on your next breath in and out. find your way to chair pose as you lift up. You might want to walk the feet in closer. Let's still see if we can keep the feet hip distance apart. And again, we're checking for that tilt. The core is on. And then the weight is transferred to the right leg without too much of a shift. Little pulses, hip extension. So we can see here we're really working Jyoti's gluteus medius, on this right leg because of that one-legged stability. So gluteus medius helps prevent sacrum pain, lower lumbar pain, hip pain, stability, I should say. So that's what we're helping her with. She's paused, so she's had enough. We can reach the arms up, take a breath out, fold all the way down. A little reprieve. You can bend the knee one, the other. You can do a little bounce, a little relax. Take a breath in, lift halfway. Really lift up halfway. Let's not carry the head with us, so let's allow that length in the neck. So softening of the chin towards the ground. Feel it into the back of the leg. So we're strengthening the hamstrings here, even though they're feeling that stretch sensation, because we're switching them on by pressing the heels down. Breath out, fold all the way down. Breath in, inhale all the way up. Sun A. Exhale, bring the hands down. Protract as you press the hands away. Step back, one and then the other. Inhale, come onto the tippy toes. Keep this protraction, so this press away of the scapula as you lower down. The core is on. Remember, we've got legs here in this chaturanga too, so they're going to work through. We're going to come all the way down. Now we're going to keep really inactive through the torso, and we're going to keep working through this lower leg. So as you breathe in, lift the legs up. Can you go straight to bending the knees? So this is going to help switch on. Now, what's happened when we bend the knees, what Jyoti's automatically done, she's now corrected, but initially she automatically splayed through her legs. So there was an increase in external rotation. Now, Jyoti really likes external rotation, so she's gone to what's easier for her. And she's come out, but she's gone to what was easier. So what I want to encourage her to do is still hug the legs in towards the center as she lifts up. Now, this isn't to square the hips or make it look a certain way. It's because I know that she's creating external rotation and she's losing that 100% strength that we could be getting here. Now lift up, good. Let's do one more. She's gotten better. Okay, exhale, down dog. Come out of it whenever you're ready. Okay, so all we've learned now, we're going to start to put it into a little bit more of a flow. So right leg will lift high as you breathe in, and you'll bend through the knee, open up through the top hip. So what I'm going to see here, which is going to happen through a lot of people, Jyoti included, is she's loved this external rotation because remember I just said that's her, her go-to. But what's happening is there's actually a collapse into this left leg. What I can see is happening. So I'm going to tell her to try to bring, let's not even think about the right leg. We're going to try to bring this left glute towards the side of the room. Good. So that's helping stabilize through this left leg. Then there's a wrap around of this inner thigh towards the outer edge of the left leg. Good. So it doesn't matter if the right leg doesn't come as high. It's that we've kept the strength in this left leg. Step the foot forward. High lunge. Good. Actually, let's find runner's lunge. Before we even lift up, remember we have legs here that are working really hard. Press this heel back. Don't forget about this back leg. And then use the strength of the back leg and the standing or the front leg to rise up into that extension. Okay. From here, we're going to stay nice and tall through the arms, nice and long through the arms. And I'm going to get Jyoti's psoas working a little bit more through this left leg so that she can feel it a little bit more when we hold into high lunge. How are we going to do that? We're going to switch it on. So we're going to do a little bend through the knee and then straighten. This is really hard. So you're doing really well. We'll do one more. And then we're going to stay in high lunge. Don't forget to breathe. Attention will go towards the right leg as we find a little airplane or warrior 3. So Weight comes forward, left leg comes back, arms come back. And then like this pendulum swing, without the toes, hopefully without the toes coming down, scraping the ground, can we lift the left leg all the way up and engage through that psoas again? So this is really strong. It can be quite challenging through this psoas to lift up. So what I'm going to tell Jodie again is that inner thigh, lift the inner thigh up. That's going to help through psoas. The toes are drawn towards you to help contract a little bit more. And what can we see is this right leg is really... it's struggling. So, so we're going to stay here a little longer. We're going to see if we can lift up and out of it and think about pressing this area of the hip out. So that's going to help switch on through glute med a little bit more. And again, this wrap around of this leg, that's better. Inner thigh lifts up. Sorry, yes, yeah. And then exhale into a forward fold. Again, breathe, thank you. From this position, can you take your next breath in and lift the arms all the way up? Exhale, hands to heart center. Take a moment, a little breath, a little sigh. And then we're going to lift that left leg back up, but keep the knee bent. And then find a little figure 4 variation, a standing variation, as you bring the outer edge of the left foot onto the right thigh. You can choose to bend here. What Jyoti's done is she's chosen to start to create a little bit more flexion, which is going to help to switch on a little bit more through these external rotators, or stretch them, I guess, these external rotators. You can let the torso go. You can bring the hands down if you want a little bit more help. And then when you're ready, you're going to come out of that. It's nice and slowly stand. Left leg returns. Inhale, arms reach up. Sun A. Exhale, hands come down. Press the hands down, step back, plank pose. This time we're moving into upward facing dog. So you can, if you want, otherwise you can stick to the variation we've been doing. Otherwise I want to test you more with that deeper extension. So as you breathe in, shift forward. Exhale, lower down. Upward facing dog as you slide over the toes. What I want here is there's this rib cage that moves forward, which helps the descent of the scapula, but also there's this engagement through glutes, the hamstrings and the lower chest spine, but mostly the glutes to lift you up. Exhale, down dog. Take a moment, take 2. Left leg rises as you breathe in. Bend the knee, open the hip. So yes, the left leg is important here, and we are feeling a stretch through the front of the hip, but remember those cues that we just learned for the right leg to help us. So what we're thinking is bringing this outer edge of the right hip towards the outside, and this wrap around of this right leg, stable through that right leg. Then maybe the left leg can lift a little higher, maybe it doesn't, that's okay. Left foot steps forward, runner's lunge to prepare the legs, and then we lift up to that high lunge position. Now remember, we're getting glute activation through this leg and the hamstring. We're stretching through here. Can I get Jodie to strengthen through here, which is going to help her stretch through here a little more? Knee pulses. It looks very simple, but it is very hard. Yes? It's subtle, but it's the subtle ones that rather than those big flows, it's the subtle little movements which help us try to activate the little stabilizing muscles, which often just go to sleep and the big muscles take on. So can we really work these little stabilizer muscles to help our strength and get the most benefit from our practice? Okay, that's enough leg, little pulsing. You can lift up to warrior 3. Remember, this top leg is lifting up into, into hip extension. So the glutes working still here, the hamstrings working here. Pendulum swing the right leg forward without, hopefully, the toes finding their ground. And remember, there's that the engagement of the inner thigh up towards the belly button. That's going to help switch on through psoas here, which is our hip flexor. So it's going to help create some strength in our hip flexor, which is going to help then allow the muscle to lengthen as well. You can take a breather and forward fold. One more breath. Let's come all the way back up. Standing figure 4. So as we soften the standing leg, there is so much strength happening through that glute med. So really see if you can focus on lifting the leg, like the abduction, which is going to help that stability. And then because we've got that forward fold that's happening, that's going to increase the stretch, which is happening through piriformis on that lifted leg or on that right leg. Take one more breath. Exhale, fold. Breath in, lift up halfway. Exhale, fold. Step back. Child's pose. A breath. I say child's, but if you've got another posture which feels like a resting posture for you, you're welcome to take that. Maybe even moving into wide leg child's pose to really allow the inner thighs to soften, that pelvic floor to soften. Remember, the pelvic floor helps create the stability through the sacrum and that gluteus region. So if we can help to relax the pelvic floor, it's going to help to actually be able to activate the pelvic floor and actually action as that stabilizer through the sacrum, through the lower back, through the glutes. Make your way onto your belly. We're going to do one little back bend before we bring the class back down. So we've done lots of variations of what we say cobra or upward facing dog today. If one of those felt great for you and you don't want to progress any further, then you are welcome to stay there. So remember just those little leg pulses as we lifted the legs up, maybe even that bend in the knee to do so. Otherwise, if it feels like you've got the opening through your front of your legs and through your shoulders, we're going to find bow pose. So we're holding the ankles as you bend the knees. And before you kick into the legs, before you kick the feet into the hands, I want you to see if you can lift up. So that's the breath in, is the lift up. Then from there, and lift the legs if you can. Great. Again, Jyoti loves that external rotation, so we're going to remind her. So if this was a class of 20, 30 people, I'm still going to say this. I'm not going to single her out, but I'm still going to say, let's remember, if you feel like the legs have splayed all the way out, can we maintain a little bit of integrity? So to do so, can you think about hugging those inner thighs in? It's not because I want it to look different for Jyoti. It's because I know that as she's using those external rotators, she's lost that stability, and that could be potentially damaging for her lumbosacral junction or for her SIJ. So I have done a lot of talking. So if you've come in, you can come out. And then when you're ready, we will do a couple of rounds so you can come back in as you breathe in, lift up. Think about those inner thighs. Great. Once you lift up, then press your feet into your hands. So that's going to create that activation through the leg muscles, but it's not going to allow you to go any deeper. So I want to make sure you've got up first, and then you can press the leg into the hands. And what's that actually doing is it's helping to switch on through psoas, which is going to then help switch it off when you stop holding it. Okay, let's just do one more if you like. Otherwise, you can find a little rest, a little moment in time. Okay, let's find a rested position. If it's crocodile, you can stay there. If that actually feels really comfortable, it looks really comfortable, then stay. You may even want to just bend your knees and rock your legs side to side, so creating a little bit of articulation through that lower lumbar. Then we're going to release all that a little bit more as you rock back to downward facing dog. If pigeon's in your practice and it feels okay for you, then do that. If not, come onto your back and you'll find figure 4 alternative. So as you step the leg forward, what I'm going to check for you, or what I want you to check, is that there's 3 points of contact. So we've got the front foot, that's a point of contact. Yep. We've got the front knee, that's a point of contact. And we've got this front hip, there's another point of contact. If there was not point of contact, and what I would commonly see is that this left knee or this right knee is lifted up, and instead a lot of the weight is going to go through the knee when she's going to come into that flexion. So she can come into the flexion because she's got 3 points of contact. I know that's going to be okay for the knee. To make it a little bit safer for the knee, I'm going to ask her to draw her toes towards her knee to create that integrity through that tibia, that tibial shaft. And you can relax and rest here. So we're stretching through the external rotators of this right glute, and again that psoas and quad through the left leg. Although there's been a lot of talk today, a lot of knowledge that's being learned, hopefully, can you just see if you can just stay in this posture without feeling like you need to think, be a certain way, do a certain thing. I just want you to find a little bit more space here, both in between the joints of the body and the tissues, but also some space in the breath. And then hopefully that will start to become, or start to create, a little bit of space in the mind as well. Let's take 2 more rounds of breath. I'll leave you for a little bit of quiet as you come back to downward facing dog if you're in pigeon, and then you will come back or come onto the other side. If you're on figure 4 on your back, you can swap to the other side. Again, because we set it on the right, we still have to check on the left. We're looking for those 3 pointed contact. So the front knee, the front foot, the front hip, and that's going to allow it okay to create that flexion over the front leg as the toes of the left foot draw towards you to help maintain some integrity through the tibia. And you can soften to your degree here. If it feels like the ground's a little bit too far away, but you do want to soften, I encourage you to bring a blanket or a block or a bolster or a towel or a pillow or anything and pop it underneath you so that you feel like the torso can soften without feeling like you have to hold yourself up with the weight of your arms. They've done enough today. We'll take 2 more rounds of breath. Purely for point of comparison, on your next exhale, you're going to make your way to downward facing dog, your last of the class. And then lower your knees down. Let's find a seated forward fold. So your legs out in front of you, a little Paschimottanasana. So the aim of this is to stretch through this posterior body, being the lumbar rectus spine, the glutes max, and the hamstring stretch. You're welcome whenever you're ready to come into the posture. If you felt like there was a pinching through the front of the hip here, what I would do is I would get Jyoti to bring a bolster or a blanket in between her thighs to limit that flexion. So she can still come into the posture, but there's not as much deep flexion. If she felt like it was still happening, we could try on our back by lifting one leg at a time. Or we could try even one leg at a time from a seated position. You can let the head go, let everything go. So this is a really internal posture. I don't want you to feel like you're holding any stress here or any, there will be tension in the posterior body, but I don't want you to feel like you're holding any strength. Just let it all go. Take one more round of breath. Slowly come out. You're going to make your way all the way onto your back. And we're going to do a little inversion here to help to open up through the psoas just for one last time. So a blanket or a bolster or a block underneath the hips as you press the hips, the feet down, lift the hips. And we're going to slide the bolster underneath. And then you're going to lengthen through the legs. So by just coming to this hip extension, we're starting to stretch through psoas. Remember, psoas was a flexor and an external rotator. So I'm going to help Jodie out here by internally rotating her legs at her ankles. So she's going to bring the legs together. You can see how restricted, or I can feel how restricted that already is for her. So she does need to work on this little psoas muscle. So we're going to create some more internal rotation. Now we're getting a little inversion at the end of the class to help to calm the nervous system, allow the blood flow to rush back towards the heart and the lungs and away from the limbs. So remember, when we've got that more stressful state, we're getting a lot of that blood flows rushing to the limbs to help us to run. We don't need that right now. We need everything come back to the center. We need everything to settle, to rest. And you can use those longer exhales and that more conscious breath to help this practice really calm you down at this point and lower that sympathetic nervous system drive and increase that parasympathetic nervous system. I'm going to stay for a few more rounds of breath. And then you can slide your feet away from the straps. Lift your hips, remove the bolster. A little rock through the legs, a little windscreen wiper. A moment in Supta Baddha Konasana before your Shavasana, just as a point of comparison without judgment to how the body and how the hips mainly feel now as opposed to the start of the class. You can start to lengthen your legs. Adjust, move around to find that resting position. And see if you can stay here for at least 10 or so rounds of breath, allowing yourself that time to unwind, unravel. Try not to move your mind towards the anatomy of what we've just learned. Just stay in the quiet. Let go of any forced breath. And see if you can just stay here in the moment. And I look forward to seeing you for our next class. Namaste.